It is about determining whether or not someone needs to be tested with a nasopharyngeal swab. And so the people who we would test are folks who have traveled outside of Canada and then within the 14 days after returning to Canada have developed respiratory symptoms like a cough or a fever. The other people who would be people who we would want to do an assessment and perform a nasopharyngeal swab on are the people who have been close contacts of a confirmed case of coronavirus.
For those folks wondering whether they need to come if they meet the case definition, I want to be very clear that this is for folks with mild symptoms. So if you have mild symptoms and you want to get tested for COVID-19, then this is the place for you. And the role of this kind of facility is to offload the pressure from emergency departments, from acute care settings, so that the flow of patients, our capacity, our ability to deal with patients presenting with symptoms requiring hospital level care, that we have the capacity to be able to engage in that.
So we want people who have symptoms, so they have to have fever or respiratory symptoms. They have to have either been a traveler themselves in the last 14 days before they got sick, or been exposed to a sick traveler. And if that's the case, then they can come to be assessed. And then based on their assessment, we'll determine whether they need to be swabbed versus being encouraged to go home and take care of themselves. If we find that they're sicker than they recognize, then we would make arrangements for them to go to the hospital. So the swabbing process involves sticking a small Q-tip into the back of the nose, very briefly, just for a few seconds, and that's all. It takes 6 to 12 hours from the time that the sample gets to the lab and is processed before we would have a result. So if the sample is getting there late in the evening, the lab isn't necessarily processing samples overnight, so it could be late in the next day before we have a result, just depending on the timing of things. We need to help reassure them, and that's part of why they're coming here. They're getting tested, but they're also getting that reassurance that, in fact, they're going to be fine, but here's what to watch for so that you know that you need to actually seek a higher level of care and go to the emergency department.